Hi, today I'm going to talk to you a little bit about the perils of oysters causing Vibrio vulnificus sepsis. So first, let's talk about Vibrio vulnificus as a bacteria. So it's a halophilic gram-negative bacteria found in warm waters along the Gulf Coast. Typically, it is in filter-feeding mollusks, including oysters and crabs, in addition to mussels. An important thing to note about this particular bacteria is that it has a high mortality rate. For severe sepsis, it's around 50%, and it's the leading cause of seafood-related deaths in the United States. So now that I've given you a little bit of background about the bacteria itself, I want to talk to you about our patient. So our patient is a 39-year-old male with a past medical history of alcoholic liver cirrhosis, and he came into the ED with bilateral lower extremity pain. He said the pain woke him up from his sleep. It was 10 out of 10 in intensity. He denied any recent trauma or increase in his activity level that could, point us in the direction of compartment syndrome. But on physical exam, his pain was out of proportion to physical exam, so it did make it a little bit concerning. In addition to that, he was basically in full-fledged septic shock on arrival. He ended up being transferred to the ICU, started on levofed, broad-spectrum antibiotics, and IV fluids. We called general surgery to evaluate for the suspected compartment syndrome, although it didn't really fit the history, and the compartment pressures were normal, and they were tense but compressible. So that, kind of crossed that off with the differential. Within a few hours of blood cultures being drawn, 2 of 2 returned positive for Vibrio vulnificus. So after we found that out, we went back to the patient. We asked him, what were your potential exposures? And he, didn't think it would have been pertinent to mention that he had had oysters at the beach a couple of days ago, and that was the cause of his infection. Despite, being treated with the appropriate therapy for his infection, the patient went into multi-organ failure and eventually passed away just 3 days after admission, unfortunately. So, now that I've kind of talked to you about our patient, I wanted to speak more broadly about Vibrio as an infection. And Vibrio can typically have 3 different presentations. One is gastroenteritis, severe sepsis, and lastly, skin and soft tissue infection. And all of these infections have a predisposition to patients with underlying liver disease or immunocompromised state. So that's something important to know and is typically a board question, especially with our liver disease patients. The infection is most common in April to October and is associated with ingestion or handling of raw seafood, most commonly oysters, which again is what our patient had. For diagnosis of the bacteria, you can do blood cultures or obtain cultures from the hemorrhagic bullous lesions that are characteristic of this infection, which you see here in the photo below. Our patient developed these lesions within 24 hours of admission. And treatment is antibiotics as expected. Doxycycline 100 PO or IV BID is recommended in addition to ceftazidime or different third-generation cephalosporins. So, in conclusion, one of the things I wanted, you guys to take away from this particular patient presentation was the importance of a history taking. Patients may not always give us information that they think is pertinent, and so we need to be more specific sometimes when we ask these questions. And especially being here in Florida with many of our patients being exposed to salt water and potentially eating various types of seafood, Vibrio is something to keep on your differential. I don't think that the outcome would have been really any different for this patient because he was being treated appropriately with the broad-spectrum antibiotics he was on. But because Vibrio is such an insidious onset and rapidly progressive sepsis, it is important to recognize the bacteria quickly and treat it appropriately. Thank you so much for your time, and I hope you enjoyed my presentation.